She is a great kid. She's really strong, really independent. She don't know a stranger.
She's beautiful, she's sweet, caring, loving. She's got a huge heart.
She was good in school, never had any problem out of her, lots of friends. She's a great kid. She's got a lot of her mama in her. She's stronger now than she ever was. I know that.
I am 23 years old. I was born in Shreveport, Louisiana. I went to Byrd High School.
After Samantha's 21st birthday get-together, she started getting sick.
Headache, backache, my neck was stiff, and that's when we first noticed that something was going on with me.
We were thinking she maybe had meningitis or a brain bleed. We took her in and they did a spinal tap.
We set that up on December 3rd, and from there it was just a whirlwind.
When I got home, I laid in bed for a few days with a spinal tap headache, which is absolutely miserable. You can't even lift your head off the pillow.
I called her neurologist here in town. They said that we could do a blood patch.
And we really didn't know what it was. We just thought it was a patch that goes on the back to cover up the spinal tap hole because your spinal fluid is still leaking. And so the anesthesiologist came in and he did the blood patch, and it is where they take a tube of blood from your arm and they inject it into the spinal tap hole to clog the hole. And immediately my headache was gone. I stayed in bed for 24 hours, like you said, and then when the 24 hours was done, that's when I got out of the bed and I noticed that something was wrong. I couldn't feel from my right knee down. And later that night, I was watching a movie with Steven, and I think I got up to go to the bathroom and I just fell to the bed because I was completely numb from the belly button down. And so I called my mom and I'm crying and I'm scared because at this point, like, I can't feel my legs.
So I called Dr. Harris's office and I told her that JoJo's leg was going completely numb now, and it was like it was traveling upward. So she told me, she said, "Lisa, I need you to take JoJo to the ER at LSU." So we got her to LSU, and that was the last time she had walked. I walked her in, and I did not walk her out.
They took me back, and immediately things just got hectic. And I remember after he had pricked my legs, poked them, and did everything, he looked at his team. It was students. He said, "This is our most important patient of the day." He said, "In this whole hospital, this is the most important."
I examined JoJo within the first 24 hours when she arrived to the University Health. Anybody that comes into the ER with sudden changes in the strength of their extremities, decreased sensation, those are emergencies for any neurologist. And especially when JoJo mentioned that she was not able to feel at all, we need to do an imaging test immediately.
A doctor eventually came in and let us know that a cyst had formed near my spinal cord nerves, which was due because of the blood patch.
Based on her history, based on her signs and symptoms, we determined that this was very likely secondary to the recent procedure that she had. Very likely this cyst was irritating some of the nerve roots that were coming out of the spinal cord and giving her the symptoms that she came with.
I was lost. This was my daughter, and I didn't know what was happening to her. I didn't know how to fix it. And she kept looking at me like she wanted me to fix it. She needed me to fix it, and I couldn't. It was like we were all just sitting there waiting on somebody to just say the magic word and do the magic thing so we could go home.
I just remember it was a long week right there. So, and we just wanted some answers, and there just didn't seem to be any certain fix for it. And, they told her she may never walk again. I knew things weren't ever going to be the same.
I didn't just lose my legs. I was having a cath to use the bathroom. My bowels wouldn't work. I had to relearn how to swallow again because it did affect my throat, my esophagus. My mom lost her job because of it. They had to get rid of her car. Her life was spent with me every single day, 24/7. I think she took it hard because I'm her baby. And she had already seen me learn to walk once. And she was having to go through it again, and not many people do that. She would have taken my place.
In JoJo's case, we knew that she had to be sent for rehabilitation. The key factor for her recovery was physical therapy.
When she came into our clinic in 2016, January, I believe it was, when she first started, I saw her coming in with her mother in a wheelchair, and I thought this child sprained her ankle. I had no idea what was going on with her. And so I soon realized that she was coming to see us for neurological rehabilitation. She went from being an average kid, being active, to being wheelchair bound. She came to us after receiving some inpatient rehab, and she wanted to walk, and that's what we were trying to get her to do.
When I was discharged from inpatient, I could only lift 1 pound. And so when we found out about LSU Allied Health, I told my mom, I don't want to go. It's not going to help me. I'm never going to walk again. There's no point in this. I was just very depressed and not happy.
She said, Mama, I can't feel my legs. I don't know what good this is going to do. The second we walked in, the second she rolled in, we got on the mat, and Evelyn walked up. I just saw JoJo's face light up.
And within the first 20 minutes of meeting her, she put the Bioness on my legs. When she did that, my foot popped up. And I freaked out. I was like, what are you doing? You just made my leg move. You made my foot come up.
The Bioness is a neuroprosthetic. It's something that we utilize to try and strengthen patients. With the Bioness system, it allowed us to strengthen in function. And so through Bluetooth technology, it would sense when JoJo would pick up her foot. And so different muscles would fire in order to have her have the type of gait or the pattern of walking that she needed to have. So that was tremendous. We know that we also have to have a system that is not on a treadmill to really mimic what we do away from a treadmill, just on overground walking. And so we have a vector system that we can utilize for that purpose, and it goes around our track.
It was this energy. She become this old JoJo. She couldn't feel her legs, but in spirit-wise, she was just this old JoJo. It was just amazing.
I was excited. I think I told my mom I will walk again. I had it in my head. They can tell me I'm not going to walk again, but I will. Going there, they changed my life.
And so at first she started walking in that way with the Bioness in place and the vector on, but with assistive devices, whether it was really a rolling walker at first. And from there we progressed to something like a quad cane, and then 2 sticks, and then nothing. And then we started then lowering the amount that we unloaded her, so her body would be taking most of her weight as she progressed forward.
I was taking physical therapy myself, and when she reached the point that she could walk with the canes or with help or get on a treadmill, you'd be surprised how many of the patients in the physical therapy clapped. because we were all interested in her recovery.
But every day they just worked her and worked her. She'd be so tired afterwards. But she'd just go home and collapse because she gave it everything. I went up there one day and they had her, this was after probably a few weeks, they had her climbing stairs. And that's the first time I'd seen her on her feet. I just knew things were going to be looking up from then on.
My best friend had asked me to be in her wedding. You know, am I gonna roll down in my wheelchair, or should I try and get up in my walker? Am I gonna wear heels? Should I wear flats? Dr. Morgan was like, what are you talking about?
But of course not. What kind of shoes do you want to wear? She goes, well, wedges. I said, well, bring your wedges in. So she's, really? I said, yes, of course. And we started very slowly, just standing, because now you've changed that whole base of support. So we practiced with those high heels first inside on our track. Then I took her outside to make sure she could do steps. She could be on grass if needed to, or uneven ground. So to me, it was a win-win, because it was showing her truly what rehab needs to be. That rehab is you being you everywhere, not just when you're with me.
I mean, they went above and beyond for me.
And at first I didn't think much of therapy. I thought it was a waste of time. But in her case, it was She wouldn't be on her feet without it. I'm sorry.
JoJo's biggest thing was running. She loved to run. Her and Dr. Morgan took off around that track. JoJo looked funny as all get outs. Me and her dad, we just cried. Oh, JoJo got to us and she couldn't help but cry. She was so proud. She couldn't run that far. She looked so funny. But that to us was the greatest experience, was watching her run.
She's a perfect example, JoJo. She was with us about 1.5 years, but she kept making goals because of the technology that we have. The Center of Brain Health will be that first center that offers certainly the education that's required, the research, but then the neurorehabilitation that is required. Unfortunately, we see other facilities, other areas that are certainly providing patient care, but it's not evidence-based. And so I love that it is actually driving our practice to be better, and that's what enhances patient outcomes. And again, JoJo's the perfect example of that. Through our neuro rehab in the School of Allied Health and our faculty practice clinic, she is now walking.
If you want the best care and the best therapy there is, I tell them all about Allied Health.
I mean, it's like a big family up there, it seemed to me. I mean, even the other patients, they all seem to, just cling to each other and work toward each other.
We all love what we do. I think it's evident in our clinic. That's why patients come back for wellness and don't want to leave. We're the best. Can I say that? We're the best because I think the fact that we care, and that's something that is not in any book and it's not on a diploma.
This happening was the best thing in my life. I did not just lose my legs. I lost friends, I lost my job, I lost independence, but I've learned to love myself. And when I would look in the mirror and see the braces on my legs or the crutches or the wheelchair, I wasn't ashamed of it. I was proud of it. This terrible thing that happened to me made me a better person. And I truly believe that. I would just say thank you for giving me my life back. Thank you for encouraging me and supporting me. And thank you for never giving up on me. Not a single one of them gave up on me. And I am so thankful for every single person who helped take care of me.